Are you waking up tired, feeling less firm, less confident, or noticing that things just aren't working the way they used to? Have those quiet moments with your partner become more stressful than satisfying? I'm Dr. Barbara O'Neill, a board-certified urologist, and for over 20 years I've helped men rebuild energy, testosterone, and intimate performance. And today I'm going to show you a simple 60-second pressure point nearly every man overlooks, yet it plays a powerful role in blood flow and potency, because what's really happening inside your body might surprise you. Before we dive in, tell me where you're watching from, and don't forget to like and subscribe. But here's what most men don't realize, especially once they cross their 50s. Potency doesn't simply fade because testosterone drops. In fact, many of the men who walk into my clinic have perfectly acceptable testosterone levels, yet they're still frustrated, still losing firmness, still wondering why their body isn't responding the way it used to. And when we dig deeper, we discover something far more subtle, something that's been building over decades, a slow, quiet decline in microcirculation and pelvic blood flow that almost no one talks about. You see, after years of sitting, long commutes, long work days, evenings in front of the TV, the pelvic floor begins to tighten without you ever noticing. These muscles are supposed to support the organs and help direct healthy circulation. But when they stay clenched for years, they become rigid, almost like a fist that never fully opens. And that constant tension compresses the very blood vessels and nerves responsible for your ability to get and maintain a firm, confident erection. Most men assume the issue is hormonal. But in reality, the bigger culprit is often this hidden muscular and vascular pressure. And there's more. As we age, our nitric oxide, the molecule that relaxes blood vessels and allows strong blood flow, naturally declines. The vessels themselves become a little stiffer, a little less responsive. Imagine your pelvic blood flow like a highway. In your 20s, it's clear, open, and flexible. But by your 50s and 60s, little traffic jams begin forming. Not enough to shut things down entirely, but just enough to weaken firmness, delay arousal, and chip away at your confidence. Pills? They can temporarily widen the road, but they don't fix the underlying traffic, and they certainly don't release the muscle tension choking off the flow in the first place. This is why so many men get disappointed. They're trying to boost pressure without clearing the bottleneck. And here's the surprising part. Sometimes all it takes is one overlooked tension point, one tight area deep in the pelvic floor to interrupt everything. When that spot clamps down, performance begins to slip long before any major health issue shows up. But this isn't the only hidden factor affecting you, and most men never realize the next one is quietly stealing their potency every single night. But here's the part most men never hear. The real gateway to stronger blood flow isn't in your abdomen, your back, or even your hips. It's in a small, often ignored region called the perineum, the soft area between the scrotum and the anus. Most guys never think twice about it. It's out of sight, out of mind. Yet this small stretch of tissue is the crossroads of some of the most important nerves and blood vessels responsible for your performance. When this area tightens, even slightly, things begin to change fast and not in your favor. Let me put this in simple terms, the way I explain it to my patients. That area is like the center of gravity for your pelvic circulation. Every major vessel that feeds blood to the penis passes either through it or extremely close to it. Same with the pudendal nerve, the main nerve that governs penile sensation, arousal response, and the signals that trigger an erection. When you're young, this entire corridor stays loose, flexible, and responsive. But with age, stress, poor posture, and years spent sitting on firm chairs, car seats, and office chairs, pressure builds in this exact region. Little by little, the tissues tighten and shorten, Eventually, it becomes like pressing your thumb over the opening of a garden hose. The water still flows, but not nearly as powerfully. This is why many men notice their morning erections gradually weaken. Morning wood isn't just a bonus or a sign of youth. It's a direct indication of nighttime blood flow. And this perineal tension point plays a huge role in whether that blood flow remains strong or becomes restricted. When the area is tight, the pudendal nerve becomes slightly irritated, and the vessels running beside it lose their full ability to expand. That means reduced pressure, weaker firmness, and slower response times. All of this from one overlooked spot you probably haven't paid attention to in decades. And that's why this point acts like a funnel. If it's open, everything flows beautifully. If it's tight, everything gets squeezed. Most men assume their issue is hormonal, but it often starts right here, in the place no one ever talks about. Now that you understand why this spot matters, let me show you exactly how to find it and the right way to massage it for real results. But here's where most men get it wrong. They think this kind of massage has to be complicated or uncomfortable. It doesn't. In fact, once you understand how simple the technique really is, you'll probably wonder why no one ever taught you this earlier. So let's walk through it slowly, the same way I teach my patients in the clinic, step by step, making sure you feel completely confident before you even place a finger on the spot. First, you need the right position. The easiest way to start is seated on the edge of a chair with your feet flat on the floor and your back relaxed. This position slightly tilts your pelvis forward and exposes the tissue we're targeting. If sitting feels awkward, you can also try standing with your feet shoulder width apart and gently bending your knees, just enough to soften the muscles around your hips. The goal is not to strain or stretch, it's simply to allow your pelvis to open so you can reach the point without tension. Now, use either your fingertip or your knuckle, whichever feels more natural. Your fingertip gives you more sensitivity, while your knuckle offers a bit more strength for men with firmer tissue. Slide your hand underneath, find the soft area between the scrotum and the anus, and feel around for a spot that's slightly tender, almost like pressing on a knot in your shoulder. That tenderness is your guide. You're not digging or poking. You're applying gentle but firm pressure, the kind that feels like a satisfying release rather than discomfort. Breathing is the secret ingredient here. Slow, deep breaths tell the pelvic floor to relax. Inhale through your nose, letting the belly expand. Then exhale slowly, dropping your shoulders and letting the tension melt downward. If you breathe shallowly or tighten your body, the pelvic muscles will resist the pressure. But when you breathe deeply, the tissue softens and the massage becomes more effective. As you press the point, you may feel a dull ache, a warm sensation, or even a slight tingling that moves forward toward the base of the penis. These are normal signs that blood vessels and nerves are responding. Sharp pain, however, is not normal. If you feel that, lighten the pressure or shift slightly to another spot. Remember, this is about releasing tension, not creating it. Hold the pressure for about 60 seconds. There's a reason this time frame works so well. Anything shorter won't fully relax the tissue, and anything much longer tends to fatigue the area. 1 minute is enough to send a strong signal to the body to let go, soften, and allow circulation to open. Many men tell me they feel immediate warmth, looseness, or a light pulsing sensation once they finish. All signs the pathway is opening. And here's the truth. This simple practice can make a noticeable difference for many men. But here's where most men go wrong. They stop at the massage and miss the second half of the formula that actually restores long-term performance. But here's what most men never realize. Releasing tension is only the first half of the equation. The massage opens the pathway, but your body still needs strength, mobility, and healthy nitric oxide levels to keep that blood flowing with the kind of pressure that creates strong, lasting erections. Think of it like clearing a blocked riverbank. Once the blockage is removed, you still need a strong current for the water to truly move. The same thing happens inside your pelvis. You've cleared the bottleneck, but now we need to build the circulation that powers real performance. This starts with simple daily pelvic floor relaxation and light mobility. I'm not talking about intense workouts or anything that makes you break a sweat. Just a few minutes of gentle hip circles, slow deep breathing, and relaxing the lower abdomen can wake up muscles that have been asleep for years. Most men unknowingly clench their pelvic floor all day long, especially during stress. Teaching these muscles to relax actually improves blood flow more than strengthening them does at your age. It's about flexibility, softness, and releasing chronic tension. Then there are two exercises I've seen help thousands of patients. The first is a slow glute bridge, lifting your hips while keeping your core relaxed. This opens the pelvis, strengthens the glutes, and improves circulation to the erectile tissues. The second is a simple supported squat hold, even if you're using a chair or countertop to balance. Holding for just 10 to 20 seconds signals the body to increase blood flow toward the pelvis and stretch the tissues we rely on for firmness. These aren't bodybuilding movements, they're circulation movements, and they work. But there's another piece many men overlook: sleep. Deep restorative sleep is when your body produces the highest levels of natural testosterone. It's also when nocturnal erections occur, which are vital for keeping penile tissue healthy. Without nightly engorgement, the tissues slowly weaken over time. So even improving your sleep by 20 or 30 minutes a night can make a tremendous difference in how your body performs. And of course, nitric oxide. A few small dietary changes can dramatically boost it. A handful of spinach, a beet supplement, a couple pieces of dark chocolate, or even just adding more citrus to your day. These foods help your blood vessels relax and widen, allowing more blood to reach exactly where you want it. The truth is, none of this needs to be extreme. You don't need long workouts or complicated supplements. What you need is consistency, small, daily actions that build on the progress you're making, because the body responds to repetition. When you consistently open pathways, relax the tissues, and support blood flow, your performance begins to strengthen in a way that feels natural, reliable, and deeply masculine. And if you're thinking it's too late for you, let me speak to you directly for a moment. But let me tell you something from the heart, something I've learned after treating thousands of men over 50. You are not alone in this. Every week, men sit across from me feeling defeated, embarrassed, or convinced that their best years are behind them. Many of them have carried this burden silently, never telling their partner, never mentioning it to their friends, and certainly never asking for help. They think it's their fault, that something inside them has simply given out. But that's not how the male body works. It's far more resilient than you realize. Your circulation can improve, your nerves can recover, your muscles can relax again, the tissues that support your erections can regain strength and responsiveness. I've watched men in their 70s, men who had all but given up, experience changes they never thought were possible. And that's why I want you to hear this clearly. You're not broken, you're not done, and you're not too far gone. Your body wants to heal, it wants to perform, it wants to respond the way it used to. Sometimes it just needs the right approach, the right consistency, and the right guidance to get there, and you deserve that. So let's talk about how you move forward. If this opened your eyes or gave you even one moment of clarity about your body, I want to warmly invite you to join this community. Everything I share here is made for men over 50 who want strength, confidence, vitality, and the kind of energy that lets you enjoy your life fully again. You're not just watching a video, you're stepping into a place where your health, your dignity, and your future are taken seriously. And remember that loop we opened at the very beginning. The idea that potency isn't just about testosterone. Now you've seen the truth. It's about circulation, tension, and restoring the pathways your body has been trying to use all along. This is knowledge most men never receive, but you have it now, and acting on it is one of the greatest gifts you can give yourself and the people you love. So if you want more guidance like this, subscribe and stay connected. Because you deserve energy, you deserve confidence, you deserve restorative sleep, and you deserve to feel like yourself again.